welcome to Wellness Series with Lucia. I'm your host. My name is Lucia Melebazi. Today we'll be discussing an issue that affects the community at large, palliative care. And in studio, I'm joined by a palliative care specialist, Dr. Carl Swart. I'm even more excited. The one thing I love about this show is it gets to connect me with people that I know from the past. Dr. Swart and I used to offer health care back then at Princess Marina Hospital. It's a pleasure to have you here, Doc.
Thanks for inviting me.
And how are you today?
I'm okay. You're doing well yourself?
I'm excited to see you. Okay, Doc, so palliative care is known all around the world, but a few people understand what palliative care is. What is palliative care?
Oh, okay. Let me try and make this simple. Palliative care is an approach, I would say a medical approach or a healthcare approach that deals with patients with life-limiting stroke, progressive illness, or life-limiting illnesses and progressive illnesses, and also, takes care of their families.
Okay.
It doesn't just focus on the patient; it also focuses on their families.
All right.
Yes.
Does it come in towards the end of the disease process, or because usually I know we tend to associate palliative care with terminal illness towards the end of the disease process. So when do we say this patient now needs palliative care?
Not necessarily. In the past, traditionally, yes, that used to be the case. But now, through research and recommendations from WHO, we introduce palliative care diagnosis of a terminal diagnosis or that life-limiting illness or progressive illness. Palliative care deals a bit more with cancer patients. That's where it started. But now we're seeing it more and more in other conditions, other life-limiting conditions such as end-stage renal disease, end-stage renal failure, end-stage heart disease, progressive illnesses such as cystic fibrosis, Alzheimer's, and the rest. Yeah.
Okay. All right. So let's try and bring it to perspective, Dr. Swart. Let's say a patient that gets diagnosed with stage 3 or stage 4 cancer, and the prognosis already, maybe the doctors can tell that there's nothing much that we can do. Where do we then start as the patient, as the medical specialist, and as the family or caregiver?
Yeah. Let me go back to that part where you said there's nothing we can do.
Okay.
In palliative care, we say there's always something that can be done. There's always something, even if it's managing symptoms, improving the quality of life. Our main goal in palliative care is that a patient should live as life as fulfilling as
quality of life.
Yeah. With a good quality of life until death or until they are discharged. With palliative care, especially with cancer, a diagnosis when it's stage 0, stage 1, stage 3, stage 4. Stage 0, stage 1, stage 2. In some cancers can be treated, cured, can go into remission, or it can just, it can be completely be treated.
Yeah.
So we start palliative care diagnosis because it deals with dealing with symptoms, or the other needs that the patient might need. We don't only focus on the physical, we focus on the spiritual, emotional, and then the social.
Yes.
It's a wholesome kind of care.
Yeah. And I appreciate you correcting me there, because maybe that is why a lot of people don't even appreciate palliative care. When I said there's nothing that can be done, and you said, no, Lucia, there's actually a lot that can be done to improve the patient's quality of life during the disease process. I appreciate that. So what are some of the dynamics, for lack of a better word? We can start with the patient. Like, what is it that they need to be aware of to empower themselves, just so that they also cope well with their disease process? And then in the same line, let's also take it to the caregiver or family members, those who will be supporting the patient. How can they support the patient without necessarily forgetting themselves? They need to take care of themselves as well.
Yeah. let me say this, and this is very important.
Yeah.
Palliative care does not equal end of life. I know for a lot of people, once you say palliative care, they think, oh, I'm dying.
Yeah.
No, it's not end of life. There is palliative care and there is end of life care. Something we sometimes call hospice, when you have like maybe 6 months or less to live.
Okay.
And then there's comfort care, right at the end when now you are actively dying. So palliative care encompasses all this, but palliative care is more than that. In palliative care, we affirm life and we regard death as a normal process. I know in Botswana people don't like talking about death, but in palliative care we try to educate people. You can talk about death. You are sick, now it's time to make plans. When you get to the spiritual side, we'll ask you things like what gives your life meaning.
Yes.
What keeps you going.
Peace.
What do you want to do before your time comes. Things like that. I don't think I got the other question. Can you repeat that?
I said also for the family now. How do they then cope? Because they need to be there to support the patient.
Yes. Now we have what you call respite care, and that is care that is given to family, and other caregivers. A family can be anyone. Yeah, who the patient says is their family.
Okay. Okay.
Yeah, there's also
they don't necessarily have to be blood biological family.
Yeah. There's respite care. Respite care takes care of people who take care of these very sick people. People with life-limiting illnesses, progressive illnesses, cancer. What it does is that, say, maybe I'll give for example, you will take the patient to, say, what you call Holy Cross Hospice or Pabalolong, so that you can have that breather, breathe, and while the patients are being taken care of there. Yeah.
So you can recharge.
You can even do it in the home. Someone can come into the home. We have volunteers, basically they can come and assist you. Yeah, that's respite care. Yeah. So we take care of everything. The patients and the caregivers, their psychological well-being, emotional, social, spiritual, and functional. Yeah.
Awesome. All right, I appreciate you bringing it home, and you mentioned, I think, 2 local hospice centers that we have. And I understand we have an association that I believe viewers, Botswana, need to know about it. Tell us about Botswana Health.
Botswana Hospice and Palliative Care Association.
Thank you. Yes, tell us about it.
So this organization was started in 2013, but it was, in 2014, inaugurated in 2014. We had Avani with the then permanent secretary, Ella Halabi.
Okay.
Yeah. So it exists just, to advocate for palliative patients in palliative care, to speak on their behalf, through the government, these organizations. One thing that I remember that we did as an association was to, advocate for this liquid, I'll call it liquid morphine. We use it a lot in managing cancer.
For pain management.
Cancer pain. Yeah, we did that, and we've been, going on radio shows, engaging the ministry, engaging the palliative care department at the Ministry of Health and Wellness. Yeah, we exist to do that, to engage the community so they know about this palliative care.
Awesome.
And it's really not known, so we try to.
And I believe you being here and talking about it, raises that awareness that Botswana need to know about it. Is it just in Gaborone, or the coverage is all around the country?
It's all over the country, but it's more pronounced in Gaborone. Wherever there's an oncology center, you'll find palliative care. Wherever there's a nurse or a doctor, there should be palliative care. Because as you remember, before I became a palliative care nurse specialist, we went through that training, that big training, and we're still doing that. We're still advocating for more training to healthcare workers and nurses, doctors, and even the community.
Yeah. It sounds very interesting and very, very important for us as viewers and the nation to know. How does an ordinary Motswana get access to the association? Like you're saying, it's not that well known, and I'm thinking there must be probably out there's an old lady or family supporting their loved one, and they didn't know that they can actually get support from the association. How do they get in touch?
Yeah, let me just say the association is for everyone: nurses, doctors, social workers, patients, their caregivers. Yeah, and I'll give you the details after this. They can contact our secretary, our chairperson, me, or whoever. Yeah. Anyone is welcome to be part of this association.
Awesome, awesome. In closing, Doc, what can you say to our viewers, just so that we kind of ease them into palliative care? Because, like you're saying, even for myself, at some point when I thought palliative care was, it used to give me a bit of chills. But now, after having this conversation with you, I realize this is something that we all need to embrace, and it's actually just out there to help us cope, help us understand, and help us be there for our loved ones. So in closing, what can you say to Botswana or to the viewers who are watching us right now?
Mm-hmm. Again, this is very important. I'll say it again. Yeah. Palliative care does not equal or equate end of life. Yeah. There is more that we can do for our patients through palliative care. We can manage, their symptoms. We can make sure that they have a good quality of life. And palliative care doesn't necessarily want to hasten, the death, of someone. Mm-hmm. Like I said, we affirm life, and we regard dying as a normal process. Mm-hmm. And we really want, our patients, especially cancer patients, those are the ones we deal with a lot, to have a good, active life until, their time comes. Yeah.
And to receive all the love and the care.
Yeah. And they shouldn't, I know this, that stigma and all that, that's the stereotype against palliative care. Mm-hmm. Ask your doctors, ask your nurses, ask your social workers. Yeah, a lot of people are knowledgeable about palliative care.
All right. Yeah. Dr. Norman Swart, thank you very much for gracing us with your presence and assisting us, using this platform to raise awareness on the importance of palliative care. And just to emphasize on what you've been saying, palliative care doesn't equal end of life. It doesn't equal death. So, and we have the association that you can go to get more empowerment and support should you have a patient that needs palliative care support. Thank you very much for joining us. From me, Lucia Malebati, and the one is Series with Lucia, thank you very much for tuning in. Do join us again next week, Wednesday. Thank you.